I'm Sanjana, and today we're going to talk about health communication and advocacy and how we can make our messages more impactful so that new innovations and evidence-based interventions reach the right people in the right way. A strong health communication framework ensures the following. The issue is clearly defined, the message is evidence-based, it reaches the right audience effectively, it motivates people to take action. Whether you're a clinician, researcher, a policymaker, it's crucial that your message isn't just heard but also understood and acted upon. Today we'll explore how to craft clear, compelling and effective communication strategies. Define the problem. Before you communicate, your issue statement must be clear. Ask yourself, what is the problem and why does it matter? Who is affected and how? What evidence supports this issue? If your audience doesn't understand the problem, they won't engage with the solution. Understand your audience. Not every message is meant for every audience. To be effective, you need to understand who are you speaking to? Patients, doctors, policymakers, media, or the general public? What level of influence do they have? What are their priorities and concerns? If your message resonates with the audience's perspective, it becomes more relatable and impactful. Crafting your message using the ABC formula. Every powerful message should follow this formula. A. Accurate, based on facts and evidence. B. Brief, short and to the point. C. Clear, no room for confusion. Tips for crafting key messages. Use simple and jargon-free language. When speaking to non-experts, avoid complex scientific terms. Don't say hypertension, say high blood pressure. Keep it short and direct. The shorter your message, the more effective it will be. A weak example is, stress is a prevalent psychological and physical consequence of the ever-increasing demands of life. Oof. But here's a strong example. Stress is normal. It's a mental and physical reaction to life's challenges. Be consistent across all communication. Conflicting messages create confusion. Here's a weak example. Polar bears are seeing fewer icebergs. Here's a strong example. Melting ice threatens polar bear survival. Which platforms are most effective? Now, Facebook is effective for sharing detailed information. Instagram is great for visual storytelling and high engagement. YouTube, ideal for in-depth explanations. How does one create impactful social media content? 1. Use engaging visuals. Infographics, reels, GIFs, polls. 2. Leverage hashtags and tagging. Use trending hashtags but always verify the relevance. Tag relevant individuals and organizations. Post consistently and at the right time. Please remember, weekdays get higher engagement, but Saturday mornings are an ideal time for posting. Use statistics wisely. Don't say 75% of people are affected by misinformation. Instead, say 3 out of 4 people struggle with misinformation. Numbers framed in a relatable way make a stronger impact. What is advocacy? Advocacy is about amplifying voices to bring about policy and societal change. Who can be an advocate? Doctors. Their credibility makes them effective messengers. Patients and community members. They bring real-life experiences. Media and journalists, they spread awareness. Policymakers and NGOs, they influence systemic change. The amendment of the MTP Act 2021. Now, in 2021, the Indian government passed a landmark bill to amend the country's Medical Termination of Pregnancy, also known as the MTP Act of 1971. The amendments propose critical changes to the law, including an increase in gestation limit from 20 to 24 weeks based on certain conditions. a reduction in the number of providers needed to approve an abortion from 2 to 1 until 20 weeks, expansion of access to abortion in the case of failure of contraception from married women to any woman, and no gestation limit in case of fetal abnormalities. So what worked? Evidence was shared with policymakers, turning them into vocal champions. Medical organizations like FOGC and FIGO led the effort. Then, traditional media was used to counter stigma and misinformation. At the same time, social media campaigns raised public awareness. All of this proves that health professionals can play a major role in policy change. Now, here's the science of advocacy with a step-by-step approach. First, set an overarching goal. What is the change that you are trying to achieve? 2. Define your target audience. Who are the key stakeholders? Fellow clinicians, government officials, academia, media, NGOs, or community members. Who supports the cause and who opposes it? 3. Determine the strategy. How will you reach your audience? What tools, what platforms will you use? 4. Craft key messages. What should your audience understand about the issue? How can you tailor messages for different groups? What is the most effective way for you to present your point? 5. Act. Regularly communicate with stakeholders, engage with social media and traditional media, participate in high-profile discussions. And last, evaluate. Is your strategy working? Are key audiences engaging with your message?
Music licensing.
Are people starting to believe in your cause?